COVID-19 cases in South Dakota have seen an increase recently.
We were in a very good place in the early part of the summer with much fewer cases, but in the beginning of August, the cases really started to trend up sharply, and the hospitalizations went up as well. So I want to emphasize this isn't just people who had a cold or had mild illness. This was an increase similar to the one we saw last fall, where people were getting sick and being in the hospitals.
Sanford Health infectious disease doctor Susan Hoover says the best thing you can do is to get your COVID-19 vaccine.
You may not be 100% protected from ever getting COVID, so having a positive test swab from your nose, the protection against actual illness and severe illness remains excellent.
People with a compromised immune system may be able to get a third dose of the Pfizer or Moderna vaccines.
Those are people with either a natural condition or a medication that's causing a pretty significant immune deficiency. So that would be things like cancer, who are now undergoing chemotherapy, an organ transplant or bone marrow transplant, somebody taking steroids or other medications that would suppress the immune system. But the data for a third dose or booster in the general population still need to be submitted by the manufacturers and make its way through the system. So the FDA needs to review it, and then the ACIP. ACIP has to decide whether or not to recommend it.
Hoover expects children under the age of 12 should be able to get a vaccine later this fall or in early winter.
So the only way to protect them for now is for us adults who are around the kids to get vaccinated. And then once a vaccine becomes available for children, I would strongly recommend that you have your child vaccinated.
Hoover says it's recommended pregnant women get their shots.
Pregnant women have been found to have a higher risk of needing an ICU, intensive care unit, needing mechanical ventilation, or even of death. So if you are pregnant, you are at higher risk, and therefore, of course, your baby is also. There is no connection between these vaccines and either female or male infertility. It's a rumor that really has no basis in fact.
And if you have questions, Hoover says you should talk to your doctor.
The most convincing thing to many people is actually having their own doctor say, I recommend that you get this vaccine, and I believe that it will be good and not bad for you. And there's no substitute for that.